Hello, everyone. Welcome back in another episode about checking the finger stick. We saw last time how to check the finger stick, and we checked and found my blood sugar to be 105, which is okay because I'll explain what readings mean in another episode and another video. But I want to show you some of the mistakes that are frequently done when people check the finger stick. All right, so one of the first things I wanted to show you, and again, I'm going to turn this camera down so that you can see the machine and all the common mistakes. Again, I'm opening by clicking here on the side and then opening it up like this. Okay, so one of the most common mistakes is to check the finger stick with an expired test strip. Notice here on the machine, you can see the date, expiration date, and we're still at the time of recording this video, this expiration date is not met yet. So it is okay for me to utilize this device, this test strip. Now, it would not be okay to utilize the test strip if it was expired, because it will give you a mistaken reading that can then confuse you or cause a lot of concern for undue reasons. The second mistake that I see a lot of people do is to not wait after applying the alcohol to check the finger stick. So they apply the alcohol, immediately check. Now that can reduce the reading, that cause the glucose level to appear actually lower than it actually is because of the effect of alcohol. So if you use alcohol, then you have to wait until it dries out, then check. Or you can simply wash your hand with soap and water. It achieves the same result without interference. The third mistake that I see happen, which I alluded to in the previous video, is to utilize over and over again the same lancet inside of the lancing device. And that causes it to be painful or cause more pain. Contrary to what you might think, actually the fresh lancet that is sharper causes less pain. And when it becomes blunt with repeated use, it causes more pain. The fourth mistake is having the setting on the lancing device too low. Mistakenly, people think that if I put the lancing device on the lowest penetration, like 1, then I will not feel pain. And actually, you won't feel pain even if you put it on the middle one or even on the higher one. But the difference is that when you put it on the lowest reading, then it doesn't have enough penetration, and you may have to poke yourself over and over again, or not have a good sample of blood, and then you have to have an error on this test strip, waste the test strip, you try again, and so on. You can save yourself all of this trouble by just having the penetration on the right setting to begin with. Another mistake that I see people do is to not have their machine with the right setting. Now, if you notice, when you open the machine, it would have a date and a time. And if you don't have the date and time listed correctly, then when you're looking back at the memory of the device, it gives you mistaken results or misleading results. So you want to set up the date and time correctly the first time that you use it, and then it wouldn't give you a problem later on. By the way, the setting is very similar to how you would set an alarm clock or how you would set a VCR, video DVD machine, anything like that. But we can go through it together if you are interested, so that I can show you directly how to do it. And of course, the last mistake that I see people do is checking the finger stick at the wrong time of the day. So what is the wrong time? Is if you had immediately eaten prior to checking your finger stick, and you check right after eating or within half an hour of eating, it will give you a mistakenly high blood sugar reading. That is, if you have diabetes. And that mistakenly high blood sugar reading can cause a lot of alarm for undue reasons. I'm talking about patients with diabetes, of course. So when is the ideal time to check finger stick for a patient with diabetes? Either before the meal or 2 hours after the meal. Before the meal, you would expect the finger stick to be between 90 and 130 fasting first thing in the morning. And during the day, 2 hours after the meal, you would expect it to be between 100 and 180. Anything above the 180 is considered to be too high. Of course, different people have different targets, in view of where they are in life and where they are with their journey with diabetes. We can talk about that in a future episode as well. But this is some of the basics and how to avoid those mistakes. I hope this video has been helpful for you. And thank you for your attention. If you have questions or you want to see something more or something specific, please drop a comment in the comment section. And thank you for your attention. I hope you have a wonderful day.